So Beth, tell us what initially brought you to our office.
So I have a daughter. Her name's Ava, and she had basically her jaw locked, and she had traditional braces, and they pulled 4 teeth, and then her wisdom teeth at 13. And so when they put the braces on and did the contraction of the braces, her jaw locked up, and she started getting like massive migraines. And
I remember she had really bad headaches, and she had pain too, right, in the jaw joints?
Yes, like the popping, and she could not open her mouth all the way. Like it had locked in that position. She could shut it, but she couldn't open it. And so, we became very concerned, obviously. And so we went to our dentist, referred us to another dentist, and she did all this testing. We had the MRIs done, we had everything done. And we went back for the consultation, to review everything that she had done. And she said, okay, so the option is you need to go to Florida and you need to get surgery done.
Wow.
And her jaw is going to be wired shut for 9 months. And that just kind of like, I don't know, inside my heart, I was like, this.
Alarm bells
head,
went
yes,
off.
and I'm like, this just does not seem right. And I just could not make the appointment. And I just, time kept going. My husband was like, are you going to make the appointment? And, obviously our daughter's in pain. And I'm like, I got to do this. And I just was stalling. And I knew, like that sense that you get, I just knew it was not, I couldn't do it. And so my husband does a lot of research. So he researched, and we found an oral surgeon, Dr. Koo, and went and had a meeting with him. And he went through all of the paperwork and the MRI and took a lot of time and told us, if this were my daughter, I would not do this. And I was like, yes, thank you. And so he's like, I have a doctor that I can refer to, you to. And so he told us about Dr. Konig, and so we made an appointment, and we came, and it was amazing because as soon as we got here and Dr. Konig explained what what he was going to do, I had like just the most overwhelming feeling of this is the right thing. And so Ava's been in the treatment now. She's had
Well, it's emotional because it's your daughter.
Exactly.
And she didn't have to have surgery.
Exactly. And she was 13 at the time, and no parent wants that, right?
Of course.
And and all the research I had done had basically said, people that have had that surgery down the road, it pops off again. Like basically the joint had come off the condyle bone, and it was not getting back on there. And so the surgery was to put the joint back on. But anyway, so people say, I've had this done, I still have pain, it's popped off, and it just didn't seem right. And so anyway, so as Dr. Konig spoke and explained what the procedures were, I just had this overwhelming feeling of this is the right thing. And so fast forward, Ava's been in the appliance now, and she's getting ready to go into the braces, not traditional braces, but
controlled arch orthodontics,
yes.
Which is the second phase.
Exactly. And so she has no more pain. She has no more migraines.
I know. Isn't that wonderful?
It really is. And her face, I mean, she's beautiful, of course.
Yes, she is.
I think she is. But there's a difference in the look of her face.
It's changed the shape of her face.
It really has,
right.
in a positive way.
Yes.
And so the annoying thing, though, is now we need to do implants because the original orthodontist had us take the teeth out, which is so ridiculous. I truly, and I feel very passionate about this, but I don't know why the Orthodontic Society does not accept this or not accept it, but acknowledge it and go forward.
Look at
this
a
way.
different paradigm.
Yes, there's no reason to have any teeth pulled. Like none. Like your teeth are all in your mouth because they're supposed to be there, and there is a way to have it to make it all fit, even as an adult, which is so amazing because that's one of the things with orthodontists is like, well, you can only do this growth as in a child because their feeling is like if you push on the teeth because that's the way they do it, then the teeth will fall out. Well, that's not the case. You grow the arch appliance actually does grow her jaw, and like it's proof. I can literally prove it. But anyway, but she has no more pain. She can open and shut her mouth comfortably. She's been able to, because of the different appliance things and adjustments and stuff that Dr. Konig has done, it's allowed the joint to heal to be able to get back on, like, to regenerate itself.
It's actually
basically.
remodeled, yes.
Yeah. And so, anyway, and our oldest daughter as well has had the same exact situation, just slightly different, with migraines, and she had the teeth pulled. So we brought her, and so she's now going through the process. Anyway, my husband, this is where the genes come from. Anyway, but he also has it, and I know that that's what it is. It's having the teeth pulled, the braces of contraction, and it just causes that slip of the disc, or not the disc, but slip of the joint off the bone. So I don't know. I feel very, very passionate about this. If I could tell anybody, I actually do. I tell so many people, you know, if the orthodontist says to take out your teeth,
right,
don't.
And there are non-surgical options as well.
Absolutely. So. And I would love to be able to get it out to everybody.
Well, this video will help a lot of people see what can be done, and we really love seeing you and your girls in the office here, and I'm glad you were able to come in and avoid that surgery.
Oh my gosh, me too. And I have to tell you, I mean, for anybody that listens to this, I love this office. Like, you guys are not like, it's not like a typical dentist office. Like, I feel like you're friends. Like, I can come in and I can talk to you, and it is very different. Like, I love it here.
Oh,
I really
thank you. We love seeing you too.
And I'm not being paid to say this.
Oh, I know you're not.
But anyway.
Well, thank you so much. I know that's an emotional story, and I appreciate you.
Yeah, I'm actually proud of myself for keeping my emotions
keeping it together
under control. But
well, thanks,
anyway.
Beth, and we appreciate you.
No
Thanks.
problem.